as a GP practice, have always thrived in providing low-cost services and access for our population. We have a lot of families who are on low income. For someone who's coming in who surely needs a doctor's appointment, but if we can see them to reduce those costs and then just grab the doctor to do the script in here. So we try every avenue of low-cost access for the patients here. So and that's what we thrive in, you know, as a community and as a service. My name is Letia Gibson. I'm a practice nurse here in Hauora Union Health. And this is my son, Paul Isaac. Do you want to introduce yourself, sir?
Hi, I'm Paul Isaac and I go to postgrad school that's in Woodby.
Any cut will affect all our services because it's not just the services that we provide. It's particularly the patients and the populations that we're caring for who are already in vulnerable situations. Majority of them smoking and actually quite overwhelmed with the cost of smoking increasing and are struggling to find a balance in where to reduce smoking in enhancing their life and well-being, but at the same time, you know, trying to cut that habit. So it's hard to try and you know, integrate support into that when we ourselves don't have referring services. Once they are out of here, we can't really see what's going on, but they need to know that for themselves. If there are any services out there they can tap into when we're not at sites. They are still on the pathway of thinking about how to and when to, that there is still that ongoing support. And Quit Smoking line and the Pacific cessation service just outside of our compound here have been immense, you know, support for us to do that, to be able to do that, because it's just within walking distance and they can just walk down and get patches and gums, no scripts necessary. There's not much that we have to tap into because there are increasing number of reduced services cut here and there, and so we're finding it a bit of a challenge, and it's quickly escalating. Just to be realistic here, there is a rippling effect of the damage that smoking is doing in our population. And if we look after those little cracks before they turn into holes, we can make a big difference.